Your lungs aren't destroyed forever. Research from the Wellcome Sanger Institute found that cells in former smokers' lungs had mutational burdens equivalent to those of people who never smoked. These healthy cells were 4 times more common in ex-smokers. And here's something that might shock you. According to Johns Hopkins Medicine, within just 1 month after quitting, lung function improves by up to 30%. But there's a powerful technique that can accelerate this healing dramatically, and it costs you absolutely nothing. A meta-analysis in medical research journals discovered that deep breathing exercises dramatically enhance lung capacity, improve oxygen exchange, and promote better respiratory muscle function in seniors. Today, we're revealing the exact 5 breathing techniques that can help repair smoking damage, even if you quit decades ago or just stopped last week. Before we begin, tell us in the comments your age and where you're watching from. We're reading and replying to every single comment. Now, without any further ado, let's get started. Number 5. Pursed lip breathing, the foundation technique. This is where your lung recovery journey begins, and it's so simple you can start practicing right now. According to the American Lung Association, pursed lip breathing works by keeping your airways open longer, allowing trapped air to escape from your lungs. Johns Hopkins confirms that between 3 to 9 months after quitting, lung function increases by approximately 10%. Here's the fascinating science. When you smoked, those 4,800 toxic chemicals paralyzed your cilia, those tiny hair-like structures that sweep mucus and toxins out of your lungs. But research from Johns Hopkins confirms that within 1 month, the cilia regain their typical function, significantly improving their ability to clear mucus and reduce infection risk. Here's exactly how to practice according to the American Lung Association protocol. Sit comfortably with your shoulders relaxed. Breathe in slowly through your nose for 2 seconds. Pucker your lips as if you're about to whistle. Exhale slowly through your pursed lips for 4 to 6 seconds, at least twice as long as your inhale. This ratio is crucial. Repeat this cycle for 5 to 10 minutes, twice daily. Medical News Today reports that this technique immediately improves oxygen and carbon dioxide exchange in your lungs. You can practice it anywhere, while watching television, in traffic, or lying in bed before sleep. Number 4. Diaphragmatic breathing. Engage your powerhouse muscle. Most people only use about 20% of their lung capacity when breathing normally. Cleveland Clinic research confirms this technique allows you to use your lungs at 100% capacity to increase lung efficiency. According to the American Lung Association, your diaphragm is a large, dome-shaped muscle at the base of your lungs. When you breathe shallowly, you're forcing your neck and chest muscles to do work they weren't designed for. But when you engage your diaphragm properly, you're activating your body's most efficient breathing muscle, one that does 80% of the work in healthy lungs. Research published in the European Journal of Cardiovascular Medicine studied 100 elderly participants aged 60 to 80 years and found that deep breathing exercises enhanced vagal tone and promoted parasympathetic dominance. This leads to reduced stress and improved oxygen delivery to tissues. Here's the exact protocol from the American Lung Association. Lie on your back or sit comfortably. Place one hand on your chest and one on your belly. Inhale slowly through your nose for 2 seconds, expanding your belly like a balloon while keeping your chest still. Your belly hand should rise significantly more than your chest hand. Exhale through pursed lips for 4 to 6 seconds while gently pressing on your abdominal area. Repeat for 5 to 10 minutes daily. Former smokers who practiced diaphragmatic breathing reported decreased shortness of breath within just 2 weeks. Number 3. The 4-7-8 breathing technique. Your nervous system reset. This technique was developed by integrative medicine expert Dr. Andrew Weil and is often called a natural tranquilizer for the nervous system. What makes it particularly powerful for former smokers over 60 is that it combats anxiety and stress while simultaneously improving lung function. A study published in PMC found it increases parasympathetic activity, which signals your brain to calm your body down. Research on post-surgical patients found that the 4-7-8 breathing technique reduced anxiety levels, and a 2024 meta-analysis discovered moderate but statistically significant reductions in resting blood pressure and heart rate. According to Johns Hopkins, within 9 months, the cilia begin to function normally and symptoms like coughing and shortness of breath become less frequent. The 4-7-8 technique enhances this natural healing by increasing oxygen saturation. Here's exactly how to do it. Sit up straight with your back supported. Place the tip of your tongue against the tissue right behind your top front teeth. Keep it there throughout. Exhale completely through your mouth, making a whoosh sound. Close your mouth and inhale quietly through your nose for a count of 4. Hold your breath for 7 counts. Exhale forcefully through your mouth for 8 counts, making another whoosh sound. This completes 1 cycle. Start with 4 cycles twice daily. Warning from the American Heart Association: you may feel slightly lightheaded when you first start. If this happens, reduce the count or practice fewer cycles until your body adjusts. Before we continue, if you've been enjoying the video so far, hit that like button so more seniors can see it and subscribe. We've got more powerful senior health tips videos coming every day, and you don't want to miss the next one. Number 2, box breathing, the Navy SEAL technique. This technique is used by Navy SEALs in high-stress situations, and now it's being recognized as one of the most effective methods for improving lung capacity. Research published in Cell Reports Medicine compared box breathing with other techniques and found remarkable benefits for respiratory health. According to researchers at the University of Colorado Boulder, breathing at 6 breaths per minute, which box breathing approximates, increases baroreflex sensitivity and reduces sympathetic nervous system activity. This means your body becomes more efficient at regulating blood pressure and oxygen delivery. The beauty of box breathing is its perfect symmetry. Equal time for each phase creates a stabilizing effect on your entire respiratory system. A randomized controlled study found that participants showed consistent improvements in respiratory rate and overall breathing efficiency. Here's the exact method. Find a comfortable seated position with your spine straight. Visualize drawing a box. Inhale slowly through your nose for 4 counts. Hold your breath for 4 counts. Exhale through your mouth for 4 counts. Hold your empty lungs for 4 counts. Repeat this cycle for 5 minutes. Dr. Ching Liang, an integrative pulmonologist, explains that your in-breath naturally increases your heart rate while your out-breath slows it down. By equalizing these phases, you create perfect balance. Practice this twice daily, once in the morning and once in the evening. And now for the number 1 most important breathing technique that could transform your lung recovery completely. Number 1, progressive lung expansion, the ultimate recovery protocol. This is the most powerful technique because it combines all the previous methods. Research from the International Agency for Research on Cancer studied 517 former smokers and found that those who quit smoking lived a median 22 months longer, with improvement in breathing quality being a key factor. A systematic review published in PMC analyzing 17 randomized controlled trials found that breathing exercises were superior to control treatments for improving exercise capacity and inspiratory muscle strength. The most remarkable finding? These improvements occurred regardless of how long someone had smoked. But here's what's truly extraordinary according to the Wellcome Sanger Institute. Cells in former smokers' lungs showed genetic profiles similar to people who never smoked. These healthy cells were 4 times more abundant, proving that cellular regeneration is happening right now in your body. Here's the exact progressive protocol combining all these techniques. Morning session, 10 minutes. Start with 2 minutes of pursed lip breathing. Transition to 3 minutes of diaphragmatic breathing. Perform 3 cycles of 4-7-8 breathing. Finish with 2 minutes of box breathing. Evening session, 10 minutes. Begin with 3 minutes of diaphragmatic breathing. Progress to 5 cycles of 4-7-8 breathing. Complete with 5 minutes of box breathing. Critical timing according to Johns Hopkins. Around the 6-month mark, cilia are working efficiently, mucus clearance has normalized, and inflammation is greatly reduced. Practice this protocol consistently for at least 6 months to see maximum benefits. Advanced tip from respiratory therapists: as your lung capacity improves, gradually increase the count in each technique. Start with counts of 4, then progress to 5, then 6. Never push to discomfort. Your lungs have an extraordinary capacity for healing. The 5 breathing techniques we've covered: pursed lip breathing, diaphragmatic breathing, 4-7-8 breathing, box breathing, and the progressive lung expansion protocol, work together to accelerate your body's natural repair processes. Remember, research confirms that by 10 years, according to Johns Hopkins, your risk of lung cancer is cut in half, and your lungs function almost like those of a non-smoker. But you don't have to wait a decade. Many former smokers report noticeable improvements within just 2 to 4 weeks of consistent practice. Print this protocol or keep notes on your phone. Share this video with other former smokers. This information could save someone's life. And remember, these techniques supplement but don't replace medical care. Always consult with your healthcare provider. Now, we want to hear from you. How long has it been since you quit smoking? What breathing difficulties are you still experiencing? Have you tried any of these techniques before? Share your story below. Your experience might inspire someone else to start their lung recovery journey today. Thanks for watching.